Pandemic alert levels also is a confusing phenomenon. The pandemic alert levels based on the World Health Organization are based on the spread of the virus itself, not the virulence of the virus, not the mortality rate of the virus, but merely the spread. How efficient and how sustained human-to-human transmission occurs. So we are now at a level 6 pandemic. It's worldwide, it's easy transmissible, and the degree of virulence is still to be identified. There's a concern as to how virulent it will be, but we just don't know yet. To give you some numbers, though, in the United States, they just released the September statistics. Over 16,000 hospitalizations directly related to H1N1 in the United States. Over 1,300 deaths related to H1N1, 11 of them in children. So it is out there. It is across southern states significantly. Some western states, we haven't seen it quite as much up here yet, perhaps because we got hit hard earlier in the spring. So there's some herd immunity that evolved, as well as what we hope vaccination will do in order to decrease the numbers. But those are the September numbers just released yesterday by CDC. And this really is the proof of the pudding in terms of the danger of that shift. You can see that every time there's a major shift, this is the H1N1 shift, here's where H2 develops, here's where H3 develops, and H1N1 comes back. Every time there's a shift, you see a spike in the mortality rate of the new strain. And it's been consistent for the last 80 plus years. But I think it gives us an understanding of what we're dealing with now that we have another, and it's not a full-blown shift, but now that we have an increase in the virulence and the transmissibility. 1918, I think this description really is very apt. As their lungs filled up, the patients became short of breath, increasingly cyanotic, gasping for several hours. They became delirious, incontinent. Many died struggling to clear their airways of a blood-tinged froth that sometimes gushed from nose and mouth. It's a dreadful business. Pretty good description of pneumonia and influenza that is as true today as then. And really, pneumonia and lung disease is the primary complication and the most significant cause of ongoing mortality and morbidity in influenza. The thing to remember is that you start with a primary viral pneumonia, but secondary bacterial pneumonia is a leading cause of mortality when you take a look at post-mortem specimens. And what we've seen for many years is that pneumococcal infection is the most common cause of secondary mortality, but what we're now seeing is that MRSA is moving into the population, and in the spring it was identified as a cause of mortality in the population as a whole. So certainly we want to make sure patients are vaccinated for their pneumococcus, but when we think about treating with antimicrobials, consider both pneumococcus and MRSA as the bacteria you need to cover for patients who are sick with influenza pneumonia, where you're worried about that secondary infection. The other thing to remember is there are non-pulmonary complications, and that's because of that excess mortality that we saw in the graph. And so myositis, encephalopathy, myocarditis, and other cardiac complications have clearly been identified and clearly are important comorbidities and causes of mortality with influenza infection. Numbers we've seen before: 25 million in 1918 died or infected in the United States, half a million died. Worldwide, they estimated 500 million people were sick, and anywhere from 20 to 100 million people died from influenza during the pandemic. And ultimately, more people died from influenza pandemic than HIV, as well as both World War I and World War II. And there's a wonderful book that was written, the story of the Great Influenza Pandemic of 1918, and it's really very likely that the reason World War I actually ended was much more because of influenza than any side actually winning the war. They were just running out of soldiers, and the peak in the soldier-age population, when you look at mortality rate, was tremendous. And so they would hit that population very badly. One, terrible living conditions, food, sleep and exhaustion, as well as people living closely together with bad hygiene. So it really was a lot of reasons for the pandemic during those years. In In general, complications tend to occur in the very young and the very old. Children, here it goes. Children under the age of 2 more common, elderly over the age of, let's say, 65. We won't look at the 46 to 64s. I don't like being identified in that population anymore. We really do see that. What's interesting is that H1N1, we're seeing complications across the board, and you're not seeing it specifically only in those populations. It's much more evenly dispersed. And in fact, the elderly may be at a lower risk of severe morbidity and mortality with H1N1. And some of that may be related to immunologic response, because it seems that part of the reason for mortality with H1N1 relates to cytokine storm and the release of inflammatory mediators due to a very robust immunologic response. And since elderly have a more blunted immunologic response due to loss of that ability as we get older and our immune system becomes less efficient, they get infected, but their mortality rate may in fact be significantly lower than what we would have expected otherwise. It's an interesting phenomenon with this virus. Ultimately, children and healthy adults bear the burden of this infection, both in the ability to transmit the infection to others, the demands on the healthcare system, as well as the economy as a whole, as well as social situations. And we all know the peak year or the peak time of the year when we see the flu, but we're seeing it much earlier this year than we generally see it. We saw it in the spring. We're seeing it now in September. It's almost unheard of to have these kind of numbers during these times of year. Infection rate clearly is highest in children. There's no question about it. More than 40% of children in the population are going to be infected in any given year, and that really goes right across the school age, much more common. And children, although frequently have milder disease, can have serious complications, and this is a partial list of those serious complications that we can get in a pediatric population. And ultimately, death is the obviously most serious complication. And fortunately, death is uncommon in children, roughly about 50 deaths a year nationwide. But in any given year, we may have a form of influenza with a more significant virulence leading to greater pediatric death. The 2003-04 season, where the average death rate tripled, about 150 deaths that year. And if you remember, that's when we had very early cases of influenza out in Colorado, in Denver, and in the West, and it hit us at an earlier time. But the mortality rate was higher that year. So the virulence will spread from year to year. The thing to remember in the pediatric population especially is that there is no, influenza doesn't play favorites. Of the children in that 2003-04 season who died with influenza, almost half of them were previously healthy, with no underlying comorbidity. So there would have been no expectation these children would have been sicker. They just were. And the spread of mortality was fairly even across the board. So it wasn't that the babies 6 months and younger died more commonly. Pretty much across the board, even 5 to 10-year-olds and healthy teenagers succumbed to influenza.